Hi everybody, my name's B. LeGrand. Everybody knows me by B, but they put me on the show as Bo because that's my government name. I'm born and raised in Hawaii, and I went to Academy of Art in San Francisco. I started my own graphic and web design firm in 2004 and left school early, and then I got into the cannabis industry after doing magazine work for other companies. I launched Edibles Magazine in 2010 because I was interested in providing education to the market in California. I had started living in Southern California and saw the need for education. There's a lot of people who are very interested in cannabis, but maybe don't know where to start, you know? How do you start? And at the time, it was Dope and Culture Magazine. Everything was very hip-hop focused, and that's kind of not really the type of vehicle that you want to use to present to your dying grandma, mom, uncle, and auntie and try to teach them about how to use the benefits of cannabis. So that's how I got into the industry. I've worked in a number of different facets of the industry. After launching the magazine, I became a manufacturer of topicals and edibles. I then got licensed in California and then now I'm a multi-state operator. I have manufacturing and distribution licenses in both Los Angeles and in Tulsa, Oklahoma. And I recently just opened a dispensary in North Hollywood called The Butter Store. And that was like quite a process of bureaucracy to go through. It took about 3.5 years to open. Had to pay rent on that facility until it opened. I did try to get a dispensary license here, but it was a very closed off sort of thing where you had to have $2.5 million in liquid funds to get a dispensary here. So I ended up not submitting for that, but I did apply for the hemp pilot program in the very beginning when they started doing the hemp permits here. And you know, I hope that everybody gets a little bit of education, a little bit of takeaway from today's talk. We're talking about cannabis for female issues, and it's something that, let's see, there we go. Everybody could benefit just a little bit from knowing what these things are. There's many different types of female pain that women have. There's PMDD, there's menstrual pain, the mood swings that come along with that. In addition, there's endometriosis, the scarring of the uterine lining with the bleeding can migrate to other parts of your organs, and then it tends to create inflammation that causes debilitating pain. I myself suffer from endometriosis. I don't have an official diagnosis. They want you to surgically get diagnosed in order to be diagnosed with endometriosis, and I don't want to cut myself open just to get a diagnosis, in which the only option is an ablation where they would cauterize the lining of the uterus, which essentially makes you sterile, at least for a year. They say it grows back, but I would like to keep my fertility, so it's not an option for me, and the only options that have been offered to me are heavy opioids, hydrocodone, Vicodin. Those are the kinds of things that I don't necessarily want to take because I'm very much into the alternative medicine. And with those types of opioids, they tend to constipate you. And when they constipate you, it causes the more problems. You know, it dehydrates you, all the circulation, and it makes the cramps worse for females. Another problem, and I also have ovarian cysts as well. Polycystic ovary syndrome is something that a lot of women deal with. Some of them may be undiagnosed because when a woman has her female cycle, you naturally develop cysts on your ovaries, and they come and go. So at one point you might have it, and at another point you might not, and it's hard to diagnose that. Same thing with uterine fibroids as well. Menopause is something else that cannabis and CBD could really help with. There tends to be like a dryness that comes along with aging, and also mood swings, and your hormones start to deplete, your estrogen starts to deplete. So with that, there's definitely some supplements that you can take in addition to cannabis and CBD that will help. Gynecological cancers, ovarian cancer, uterine cancer, cervical cancer, vulvar cancer, anything down there, those types of cancers, cannabis can really, really help with. It's not just helping with the pain and the nausea, it's an anti-inflammatory, and sometimes when you're using things like suppositories, it's a direct route to the problem. We're going to talk next about the different delivery methods that you can use from cannabis specifically. And the fastest way is inhalation and smoke and vape. So if you are in immediate pain and excruciating pain, The fastest relief that you're gonna get is from smoking it or vaping it. When you inhale it through your lungs, you feel it within 10 to 15 minutes, and it absorbs faster than any other delivery method that is possible. Another that you guys are probably familiar with is tincture. A sublingual tincture allows you to take a tincture under the tongue. If you hold it there for 10 to 30 seconds, it absorbs sublingually into the salivary glands. And then once you swallow it, you start to metabolize it through your liver. So it hits you once in the immediate delivery under the tongue, and then again through the GI tract once you digest it. Topical balms and oils are pretty obvious, for pain, muscle cramps. You can use bath salts, bath soaks. I like to use bath salts and bath soaks when I'm having my female cycle because I have pretty debilitating periods where I end up having to be out of work for 2 straight days, and the only thing that helps is being in the bathtub for me. Capsules are another way. It's just like the tincture, you would take it orally, ingest it, and then of course edibles. And edibles tend to be, basically if you're smoking, and you can smoke concentrate, concentrate is about 40 times more concentrated than just smoking a regular joint. And when you take edibles, it's a totally different delivery system when you're digesting through your liver and absorbing through your liver. And everybody's different when it comes to edibles. So I can't tell you how many stories that I've heard being Edibles Magazine where somebody's tried edibles and they have that horror story of, oh, I ate one and then, oh, I passed out for 3 days, it was too much, So it's really important to figure out what your dose is because everybody's different. With edibles, 5 milligrams to you may be nothing to me, but that might put you out for a whole day. And so everybody's very different when it comes to that. And when it comes to dosing with cannabis in general, it's just like pharmaceutical dosing. So it's a trial and error effect. You sort of have to keep trying, start low, go slow, try, figure out what it is that helps you, but don't overdose, or if it's a tasty edible, don't eat the whole thing, because then you're gonna have the side effect of being too high. Or a lot of people like to say, I'm dying, I feel like I'm dying, because they're having like the panic attack, And then suppositories, as briefly mentioned, is the direct path to those types of problems, which you can also use for GI problems, IBS, Crohn's, anything that has to do with the colon, the rectum, prostate. That would be the easiest way to access the problem without having to break it down through your stomach acid, because then you're only getting about half of the dose of what you're trying to consume. Now, with understanding cannabis dosing, like I said, you want to start low and go slow. 5 milligrams of THC is a good starting point. You can go all the way up into 1,000 milligrams a day if your body can take it, but it takes a lot to get to that kind of tolerance. As I mentioned, everybody metabolizes cannabis at a different rate. So, it could be 10 milligrams today, 20 milligrams tomorrow, something that, is a daily maintenance thing. Or in the case of if it's a period that's happening every month, it might be, I need 100 milligrams right now to deal with the type of pain that I'm dealing with. So using a ratio dosing, like a 1-to-1 CBD to THC ratio, is a really good way to sort of balance the effect of what you're trying to dose with. The human body has CB1 and CB2 receptors. So in your cannabinoid system, it is native to our body to take in cannabinoids. But when you're taking CBD and THC, there's only so much cannabinoids that the receptors can take before your receptors are like, I don't need anymore. And so the studies that have been done show that about 60 milligrams of CBD a day is the max that you should take, depending on what your problems are, because beyond that, there's not additional benefit beyond 60 milligrams of CBD a day. Then CBD is the anti-inflammatory, which, if you guys don't know, the CBD is patented by the US government for all of its benefits, all of its medical benefits as an anti-inflammatory, a neuroprotective, and antioxidant. And if you didn't know, CBD is the antidote to THC. So if you're ever feeling like, I smoke too much, I'm too high from these edibles, if you have CBD, just straight hemp-derived CBD, it will reverse the effects of the THC. So THC, if you prime it with CBD ahead of time, it will make you feel less high, when you take the THC, which is why the ratio dosing is important, because it balances out that analgesical effect. Everybody develops a tolerance after a while. So once you've got a tolerance, then you have to take more and more and more. And you want to be able to sometimes take a break so that you still have the effect as well. So there are a number of different natural herbs that can also help with female issues. Some of them that I like to use on a daily basis: cinnamon, clove, rose, lavender, ginger, peppermint, curcumin. Evening primrose oil is very effective. Dong quai is a Chinese herb that also helps with inflammation in the uterus. Nigella seeds, chasteberry, marjoram, green tea, ashwagandha, chamomile, and echinacea golden seal are all really great for female issues to help balance the hormonal system and replace some of the enzymes that we're losing when we have our period or going through menopause and losing some of our hormones that way. And some of these things you can take in oil form. You can also take them in a capsule form. With cinnamon and ginger, you could get that in powdered form and just be taking that in like your tea or throw it in your food, bake with it so you're getting more of it than you normally would if you just weren't consuming ginger or cinnamon. Same thing with curcumin. That's a very savory thing, and turmeric. You can add that to anything that you're eating to sort of add those beneficial herbs into your daily routine. Green tea is also like a very well-known anti-inflammatory, and chamomile as well. For me personally, when I take herbs for my period, I am on a black cohosh regimen, as well as evening primrose, iron, and echinacea golden seal. And I've found that for myself, that combination is what helps, like, more than anything in terms of the type of pain that I deal with personally. There's a number of other things that we can do within our own dietary changes to help with female issues. One of the things is increasing your omega-3s. A 2014 animal study found that having a high ratio of omega-3s to omega-6 fatty acids help reduce inflammation on endometriosis like lesions. You can also reduce your trans fats intake. A lot of what happens to us tends to be environmental or toxins that we receive from chemicals and pesticides, just from the outside world, even from your home. Living in your home, you're exposed to over 2,000 chemicals and pesticides that you probably don't even know about in furniture, fabric, linens, the chemical household cleaners, all of those things. You can also increase your intake of antioxidants, CBD being the antioxidant patented by the US government. And that can reduce chronic pain for pelvic pain, endometriosis related pain. You can also try an anti-inflammatory, like an alkaline diet, to help reduce some of the symptoms that come with endometriosis-like symptoms. And sugar and processed foods, of course. So we constantly are living in like a world of everything's processed. We have a very, very, very highly processed diet, and you don't realize how much sugar is in everything that we eat. If you turn over the label and read sugars, everything's got 20, 30 grams of sugar per serving, and all of that's really bad for your system, and it creates inflammation. And inflammation is the root cause of all disease. So whole food diet, natural fruits and vegetables. I've noticed when I cut out gluten and dairy out of my diet that really improved my female cycle. And like I said, omega-3 fatty acids, and man-made fats are really bad, trans fats. Carbs that are highly processed are really bad. Sometimes it's really hard to eat whole grain or ancient grain, and everything that we sort of consume is a bit GMO'd. So the more that we can reduce the amount of processed food and GMO foods that we eat, absolutely helps with the inflammation in our bodies. There are some additional supplements that you can take. I like to take zinc, iron, B6 and B12. Vitamin D has also been shown to reduce some of the inflammation in the uterus. Niacin, also known as B3, thiamine, B1, and magnesium. Magnesium's known for reducing muscle cramps. So if you're ever having like really bad cramps or that kind of pain, muscle pain even, if you take magnesium or even like a magnesium bath soak, that will help reduce some of the cramps that you're dealing with. Some additional changes that we can make. as I sort of already mentioned. We can eat a healthy diet, we can stay hydrated, reducing and managing stress, getting some meditation and yoga in, some regular exercise. Sleep is the #1 thing. You need to get enough sleep. People tend to have more cancers and are at higher risk for cancer if they don't get enough sleep. There's been a couple studies done where people that work on graveyard shift have more cancers than any other demographic that's working out there in the working world. And then endocrine disruptors, tobacco smoke, pesticides, herbicides, plastic, flame retardants, cleaning supplies, fragrances and lotions, parabens, phthalates, forever chemicals. The list keeps going, and it's really hard, especially in Hawaii where everything's really expensive, to sort of consume your products in like a healthy way. But there are things that you can do, like instead of using, a facial wash that might have 100 different chemicals in it, you can use coconut oil with coffee scrub as an exfoliant. And there are natural alternatives to using some of the endocrine disruptors that we might not even realize are in the products that we use on a daily basis. Things like shampoos and conditioners, all of those things are going right into our scalp, giving us all kinds of toxins all the time. So if we can reduce those things, those really help as well. In addition to using things like natural herbs, cannabis, getting the right kinds of supplements in our diet. Since most of our human diet in the modern world, we're lacking vitamin K, eating more leafy greens, all of those things will really help. But for direct to the path, I say suppositories are the best way to deal with immediate pain and with menopausal pain. The other thing that suppositories are really good for, and topical lubricants, is when a woman starts to lose, some of the wetness and she becomes dry in the vaginal area, it can increase orgasms. So from a sexual standpoint, if you're having any kind of libido problems, it can help not only lubricate, but also what it does is it expands the blood vessels, so it feels more intense. And but you want to be careful when you do find cannabis lubes, because they're often based as a coconut oil or an oil-based, and oil-based lubricants are not condom safe, so it could break the condom. But that is most of my presentation, and I would like to open the floor for any questions that anybody might have in terms of cannabis and female pain. Does anybody have any questions? It's kind of a taboo subject, isn't it? You wait, you want to ask privately? Okay. Yeah. I mean, it can be embarrassing to talk about this stuff. Not enough time and energy goes into spending on women learning about their own body. I think we are often taught to feel that this is a taboo subject, but we all have hoo-has and we all have rectums, it's important to talk about these things. My dad was just diagnosed with colon cancer, and he had a colon resection, and when we went in to talk to the surgeon, she said, I wouldn't use cannabis. I wouldn't use the suppositories. And that, all the work that I've done in the last 12 years of my life in this industry, that's really hard for me to try to communicate to my dad that it's okay to use. Now, yesterday, his oncologist actually told him that it can help with pain and nausea, and it's great for cancer. So it's really down to education. What does this doctor know that that doctor doesn't? And there's not enough studies done out there. Because cannabis is still a Schedule I drug, that's why there isn't enough medical studies. That's why there's not enough research. But we know for a fact that it does have medical benefit, because the government owns the patent on CBD. And that patent is licensed to GW Pharmaceuticals for Sativex and Epidiolex, which is distributed in America, the UK, and Canada. So those two products actually have a patent behind them, and that's how you know that there's medical benefit, because the government owns the patent and has licensed it out. So it just tends to be the stigma attached to using cannabis, or the feeling of getting high, or the mind change of the psychoactive effect. But when it comes to using suppositories, whether it's rectal or vaginal, you don't quite feel it the same way. It doesn't, if you took 100 milligrams in a suppository or the rectum, it doesn't hit you like an edible would. It goes straight into the bloodstream and straight to where the problem is, and it's not something that would knock you out the way that you would if you were consuming it orally. But I've got some suppositories at my booth if you guys want to come check them out. They're 50 milligrams each. They come in a 2-pack. They're only $10. We've got some freebies and goodies over there too if you want to check it out. And feel free to ask me any questions directly if you guys have any questions at all, looking for any education. We've got some free magazines over there as well. And it's, education. You can also download our app, Edibles Magazine, on the iTunes, the Google Play, Kindle. You can read all of our back issues, and they're all available online for free as well on our website at ediblesmagazine.com. All kinds of stories, people's testimonials, recipes, product reviews, all that good stuff. Very much, lots of education there to digest, pun intended. You had a question?
So I know every state is different.
Yeah.
One thing, I've actually, so I have PCOS, so I'm affiliated. But
Yeah.
then weed has kind of changed my life because the only option I ate was with birth control pills.
Yeah.
And that was it. And when you're trying to get pregnant, you don't want birth control pills.
No.
But the idea, what's been hard for me is we don't have a great lotion blue market yet here.
Yep.
And I don't know how long that's going to. I will actually get a layover in Portland or in San Francisco just so I could go to the store
Yeah.
and get something.
Totally.
We don't have those options here. Do you know how far the market is from coming to this area?
Well, here it's medical only, right? And then some of the stores might not even have the suppositories. And the problem here is that when you go into the dispensary, you can't see, touch, or smell anything. So it's really hard to get the education that you need when it comes to that. Even in California where it's recreational and I have a dispensary, it's far and few between to find manufacturers that actually make suppositories because they're hard to make, they're not that shelf stable, they tend to melt, and it's a high cost to produce. And with the regulation in places like California, it's increased the cost that every 80 cents on every dollar goes to taxes. That's why the prices are so high when you go to a recreational dispensary. So they're getting taxed at every stage in the game because they're taxing tax, and the city gets their tax, and the state wants their tax, and then their sales tax too. And even if you have a metal card out there, you only get a 2% discount on the tax. So it makes it really difficult. Places like Oregon, there's definitely lower cost, less taxes, and wider availability in the market. It's just hard to find a consistent supply, right? So you can make your own. It is possible to make your own. You can buy molds on Amazon, and I can send you some links to some articles on where and how to get supplies for that. But you could buy all of the supplies on Amazon and make them yourself if you have your own supply. So if you had your own flour, you could extract it into either coconut oil or grapeseed oil or olive oil, and then use that oil combined with something like shea butter, and then put it in the freezer and use it. And that's, for PCOS, I would definitely just start making your own, or if you want to try some of the CBD ones that we have, you can try those, and then you can get them from us on a regular, we'll sell them online. But they're CBD, and really the best benefit's going to be CBD with THC.
That information is great. I have one more follow-up.
Yeah.
So I found your session, I'm so excited to come today because I find cannabis space a very dude space, and it's where it's hard to ask questions, where I have a few minutes to go talk at the dispensary, I'm like, hey, give me weed lube with the guy who's so white.
Yeah, it's true.
And so what would be your advice because again, I do feel like all of the dispensaries here are very male heavy. So what questions do you ask, or how do you kind of assert yourself in that space, as trying to be somebody who's learning?
Well, first of all, there's no shame in it, right? You're a patient, you've got your card, I'm a medical patient, these are the problems that I'm having. I used to work at a dispensary in West LA, and when I started working there, I thought that 95% of the people were just trying to get high, and it was recreational. And when I started working there, I found out it's the exact opposite. 5% of the people who came in were looking to get high. They're just, I want to get faded, what's fire, 95% of the people came in with real problems. Insomnia, Tourette's, terminal cancer, the list goes on and on and on of the different types of problems that people have, whether depression, MS, arthritis, and everybody's different in how the delivery method is going to help them. What I would do, and what I found helps me, is a multifaceted approach. So when I'm in severe pain and having these kinds of issues, I smoke first and foremost. I use topicals, I use the bath salts, I also use the suppositories and the edibles and tinctures all at the same time. Because if I'm bombarding the body all at once with trying to correct the problems that I'm having, then it reduces the inflammation from every aspect instead of one here and one there, you know? But in terms of going into the dispensary, you just ask them, do you have any suppositories? What do you have for period pain? What do you, I've got, you know, if it's a dude, you could be like, hey, I've got some female problems. Is it possible to talk to a female bud tender? You know, I'd be a little bit more comfortable just talking to a female about my problems, because some men will not understand. Some men are really in touch with their feminine side and really open about it. And you know, like, bless your husband's heart for being here. I'm like, just appreciate you. I'm like, bringing her here. But you know, there's just no shame. And if you don't feel comfortable with a particular bud tender, you could just be like, hey, I have questions. Can I speak to a woman? You know? But that won't work in Washington, because in Washington, they're not allowed to talk like at all about anything. So different states have different laws, like you're saying. And if you're in Washington, they're not allowed to give any kind of pharmacological advice whatsoever. So there's no consulting or...
In no state are they allowed to.
Right,
A
right.
bartender is not allowed to give medical advice in any state.
Not medical advice, but they can refer you to products that might have, you know, a benefit to you. You know, so that's part of it, is that bud tenders are not trained pharmacists. You know, and in Canada, they have to have a pharmacist on staff. So because it's federally legal, they've required a pharmacist be on staff for every dispensary license that there is. So, you know, once we get to federal legalization, things might change just a little bit, but it's kind of like doing your own research, knowing what works for you, and then attacking it that way. Yeah. Anybody have any other questions? No. 425. So in the middle, next to the main sponsor booth, we're Edibles Magazine. We've got the leggings up on the wall, 425. Yeah. Thank you, everybody. Have a great day.
Well, the recording came on something, so you missed the first part.
I will ask. It'll be somewhere. Also, if you follow our YouTube channel, Edibles Magazine on YouTube, you can follow us there, and I'll post the whole video.